Hi there, I'm Dr. Brigid Norton. You can call me Brigid. This is Menopause Bytes, where I unravel the mysteries of menopause for you in bite-sized episodes. Today, let's talk about induced menopause. That's menopause caused by surgery or medication. Menopause is officially defined as going one full year without a period, with the average age of menopause in the US and Australia between the ages of 51 and 52. Naturally, timed menopause is usually preceded by up to 10 years of perimenopause, or what we now call the menopause transition. This is a phase where the ovaries begin running out of eggs, which leads to fluctuating hormone levels. Every woman's experience of perimenopause is different and unique, but for most of us, these hormonal swings tend to bring on symptoms like hot flashes and night sweats, mood and sleep issues, and brain fog, to name just a few. These symptoms vary in intensity and can come and go in perimenopause. Once you're menopausal, these hormone fluctuations stop and your levels drop to menopausal ranges. But it's usually not an abrupt change, as your hormones have been wavering for some years. In comparison, induced menopause occurs suddenly due to surgery like having your ovaries removed or medications like chemotherapy. This is a sudden and abrupt change that causes a rapid drop in your hormones, specifically in your estrogen and progesterone levels. And this leads to more intense symptoms compared to the natural transition of perimenopause into menopause. For instance, 60 to 80% of menopausal women experience vasomotor symptoms, the technical term for hot flashes and night sweats. Nearly all women with induced menopause experience vasomotor symptoms. Symptoms like vaginal dryness, sleep problems, brain fog, and mood swings can all be more severe and disabling than a natural menopause too. Testosterone levels are less affected by induced menopause, as only about 50% of testosterone comes from the ovaries. The rest is mostly produced by the adrenal glands. So, in an induced menopause, it is not as certain that testosterone levels will drop as dramatically or that you'll experience issues associated with less testosterone. Instead, the more noticeable changes tend to come from the sudden drop in estrogen and progesterone. Induced menopause carries significant long-term health risks compared to naturally timed menopause. Menopause before the age of 45 or surgical menopause before age 48 increases your lifetime risk of osteoporosis, heart disease, stroke and dementia, and emotional challenges like depression too. This is also true if you just had your uterus removed before age 48 and your ovaries were left behind. You too are at increased risk for these health conditions. Early recognition and treatment is crucial, and menopausal hormone therapy is the go-to option for relieving symptoms and protecting against those long-term health risks. Even if you feel fine and aren't experiencing menopausal symptoms, menopausal hormone therapy is recommended until the average age of naturally timed menopause, again between the ages of 51 and 52. We then reassess based on your individual needs. For induced menopause, standard hormone doses may not be enough. Higher doses of bioidentical hormones are usually needed and are tailored to your age at the time you experienced induced menopause. This often means starting with higher doses such as the 0.1 milligram estradiol patch or equivalent and adjusting as needed. For bioidentical progesterone, a 200 milligram nightly dose of progesterone is usually what we use with a higher dose of estradiol. Hormone levels might also be tested to ensure optimal replacement for your age. This is not what we do with naturally timed menopause, where treatment really focuses on symptom relief and not getting your hormones to a specific level. For induced menopause, we might aim for an estradiol level between 80 and 120 picograms per mil, which is based on expert opinion and not great scientific data. If menopausal hormone therapy isn't an option due to health conditions like certain cancers or blood clots, or you can't tolerate hormones, non-hormonal treatment options can help you manage your symptoms. Induced menopause can have a profound impact on your overall health as well as your quality of life. Seeking medical guidance promptly allows you to address symptoms and reduce your health risks. For more on testosterone, bioidentical hormones, and non-hormonal options, please listen to my episodes on those topics. So that's it for another episode of Menopause Bytes. Here are some take-home bites to remember. Induced menopause is menopause caused by surgery or medication and often happens earlier than naturally timed menopause. Symptoms tend to be much more abrupt and severe with induced menopause, and there are long-term health risks associated with induced menopause, including an increased risk of heart disease, dementia, stroke, osteoporosis, as well as depression. And finally, menopausal hormone therapy is recommended to negate these risks until at least the age of regularly timed menopause, for those of you who can take menopausal hormone therapy. Until next time, may your hot flashes be bearable, your nights restful, and may your wrinkles be laugh lines.